Thank you everyone for joining. I am very happy to be able to host this panel with so many amazing people. We have our patients here. We have Amy Shecter, who's the CEO of GlamSquad and EverBody and many other amazing companies. She's going to be moderating the panel. And Amy, I'm going to bring it to you. Thank you everyone for joining.
Great. Thanks. Hi, everybody. Thank you for being here. Bracha was kind enough to talk a little bit about my background, but really my background is I'm a 5-time CEO. I've helped support companies in all different kinds of beauty and fashion and wellness and medical, retail, and now I'm working in a number of different entities from jewelry to GLP-1s. And we were chatting about this idea that there are so many people that have so many questions. And why don't we do a webinar and see if we can answer some of those questions and engage with people to learn? So what's on your mind? What are you thinking about as it relates to a GLP-1? And could this session help you consider one to do it, to not do it, or to just be educated? So with that, I'd like the panel to introduce themselves. And what we've done is put together a team of people that should help you look at it from all different sides. So from the point of view of the doctor, the nurse practitioner, and people who have been through it. So Bracha, do you want to give everybody a little bit of a background on you?
Yes, thank you. Thank you, Amy. Bracha Banayan, family nurse practitioner and CEO of IVDRIPS. I started doing weight loss in our practice about 3 years because I personally have gained 15 pounds during COVID and I struggled to lose it. And through my journey in trying to lose weight, I went on Ozempic semaglutide and I learned a lot about the medication. I realized how powerful it was when used correctly. And I learned that we could help many people through navigating taking the medication appropriately could help save many lives, but also help people just feel and look better and feel more confident in their body. And so that's me in a nutshell. And thank you everyone for joining. And I'll pass it to Dr. Halstrom, Amanda.
Hi, everybody. My name is Amanda Halstrom. I am an endocrinologist, so I specialize in hormonal imbalances. Specifically, I see people for type 1 and 2 diabetes, PCOS, thyroid disorders, as well as many other hormonal abnormalities. But I have a particular interest in weight management and obesity. I have a similar background to Bracha. I kind of struggled with my weight for when I was younger, and then I started playing tennis competitively, and just realized how how far taking care of your body was from both a dietary perspective as well as exercise. And so I decided to sort of focus in on this field in my profession. So I have a lot of experience prescribing GLP-1s, and many of my patients are on GLP-1s. So I'm happy to answer any questions today.
Wonderful. And how about you, Katrina? You want to intro you?
Hi, yes, I am Katrina Walczak-Reuter. I am just from Chicago. I'm in sales and healthcare staffing and recruitment, and I am a GLP-1 user, very thankfully. So just like Bracha and Amanda, I kind of got to a point in my life where I said, you know what, I'm going to take back control of this, and had my hesitations at first, but it's been an absolutely beautiful and wonderful journey and educating myself in the realms of all the things again, as well as, obviously just getting back to it and taking care of myself and getting back to being confident. So I'm happy to be here today, and I'm happy to share, obviously, any of my personal experiences, and I'm looking forward to learning a bit.
Great.
Amazing.
And you, Rachel?
I'm Rachel Ostroy. I am a business owner. I have a clothing store. I also have a social media platform. I'm a voice for Israel. I have a clothing store. I have a lifestyle page, and I have 3 beautiful children, married for almost 10 years. And I'm a user myself. I shouldn't say it like that. Doesn't sound so great. Um, and I just found juggling all the balls of life, looking good, feeling great, hard. And I said, I need to find a different journey, a different path to really boost my life. You want to look good, you need to feel good. You want to feel good, you need to look good. It's inside out. And on this journey now, almost a year. I started in March, and I've never been happier. So
Wonderful. Thank you.
that's me in a nutshell.
Okay, well, thank you. Okay, so let's get right into it. And please, I can see that there are people that have already started to ask questions. Please feel free to ask questions. The goal is to answer them. And anonymous attendee, we will get to that question, but just in a minute, because we're going to first introduce what GLP-1s are. And so we're going to turn it over to you, Dr. Halstrom, and explain what a GLP-1 is and how it works.
Great. So GLP-1s are sort of the umbrella term for our incretin hormones. So we have GLP-1, which is a glucagon-like peptide 1, and we also have GIP, which is a gastric inhibitory polypeptide. When these medications first came out, we were really just targeting GLP-1, the GLP-1 receptor. That's where we have semaglutide or Ozempic or Wegovy. And then later on, we developed this medication that targeted both the GLP-1 as well as the GIP, and that's tirzepatide, which is the other flavor of these types of medications. And what they do is very similar. One just does it a little bit better. But what they do is they target the gut. So they basically slow gastric emptying. They slow the digestive process, which signals to your brain and to you that you're not hungry. It decreases your appetite. It increases satiety. So it increases that sensation of fullness. So you notice that you'll be eating a lot less to get to that feeling of being full. So that's the main mechanism of how it works to help with weight. And then, of course, we use these medications also to treat type 2 diabetes. And their effect is to lower blood sugar through regulating both insulin, which is a hormone, as well as glucagon.
Wonderful. Bracha, can you tell us how your company uses GLP-1s in your practice? And, a lot of people have questions of which medication is right for me. How do you know which medication is right? Do you test it? Is there a formula? How do you figure it out?
Sure. Great question. Thank you. We use GLP-1s as a tool to help patients develop new habits. So we don't use it as we don't use it as you're going on this medication and just fully rely on the medication. We use it as a tool to help you develop new skills and new brain pathways to have new healthy habits, to have you have sustainable weight loss. We also use it as a way for people to start listening to their body instead of silencing it, where we go slower on the doses as we increase them, for them to start listening to what their body's telling them versus decreasing any appetite of ever being hungry so that their body is silent. So we use it as a tool. When we talk to a patient, we learn about their goals, what they're looking for, what their medical history is, and what their real struggles are. Is it, binge eating? Is it menopausal weight gain? Is it, I've been struggling with weight my entire life. And so based on their history and what they're struggling with, we're able to, it's art and science together, make an assessment about which medication would be better for them. So it really depends on their medical history, their goals, and really why they gained weight and what they're looking to fix. And sometimes there's like a lot of hormonal changes that happen. And so certain medications work better with the hormones.
Thank you. Quick question, Rachel. When you started using the GLP-1, that was about a year ago, you said, almost a year ago. What has your experience been like? And you've been on it a year, and a lot of people are just starting out. What is that journey like?
So I have to say a couple of things. I had spoken to Bracha about it, a couple of months before that. And it's really a commitment. It's a lifestyle change. People think it's like this. Bracha and I were talking about it. It's not just like a magic potion. You take it and you're going to get skinny. Everybody thinks it's like the skinny pill. Everyone thinks it's like count to 10 and like, oh, she's on Ozempic. She lost weight. Not the case at all. You have to be committed. So there are different steps that you have to take to see what's right for you. In the beginning, Bracha had put me on a different dose of semaglutide, and I was nauseous for a little bit. It went away right away, and I wasn't losing weight. And then Bracha changed it up a little bit to a different medication, and I started shedding the pounds. So let me put it like this. I started in March. I would say in June, I didn't see any results. And then from June to August, people were coming up to me. What are you doing? Oh my God. And it was such a great feeling. I see Katrina's like smiling, like she understands the feeling. And the commitment that I also made was listening to what Bracha was telling me. There are certain things you need to do. You need to weight train, you need to exercise. I haven't like tackled those yet because that's not like who I am. But now that I'm starting to see results, I know it's something that I have to do. Drinking the water, doing the exercise, staying away from sugar. So that's what I'm trying to say. When people think it's like this magic potion that's just going to make you lose the weight, if you don't do the work, you're not going to see the results.
Yeah.
The
Thank you
journey
for
was
that.
really, I want to just add in, many people have the medicine administered through a doctor and they just write them a script, and they're not really having a one-on-one with someone who's guiding you through the journey. With IV drips, I have to tell you, Bracha checks in with you every single week. Like, part of the reason I told you I'm busy, I work, I have a store of 3 kids, I'm married almost 10 years. She cares about me and me seeing results more than I do. So she calls me and she's like, Rachel, we need to jump on a call. Tell me what's going on. Let's increase. We need to do this. You need to stop eating sugar. She's like a coach. It's like Rocky Balboa with the coach. It's like a good boxing match.
Yeah.
And when people
Yes.
ask me, because I talk about it on Instagram and I share it in my store, because I'm a really authentic person. Like, I'm not going to sit here and tell you I started exercising, because I don't. But if you want to see quicker results and you want to do it the right way, if you follow the regimen, the work will pay off. So I'm losing weights a little slower now, only because I'm not following through everything I should. And if I would, I know I would be losing more weight.
Terrific.
But the journey has
So
been
Dr.
amazing.
Halstrom, I'm curious because a lot of people are asking, how do I know if I'm a candidate? How do I know if it's right for me? How do I know if I'm on the correct medicine? What are the answers to those questions?
Yeah, those are good questions. So as far as being a candidate, so the guidelines, which are guidelines, they're not, things written in stone. We just use them as a guide. Say that if you have a BMI of 27 or above, with a comorbidity, and a comorbidity can be really any side effect from being overweight, high blood pressure, high cholesterol, heart disease, diabetes, um, obstructive sleep apnea. I mean, there's a long list. Or if you have a BMI of 30 or above without any comorbidities, then technically you qualify to take these medications. However, it's sort of a gray area because BMI is not the best measure of someone's overall health. BMI is a number that tells you your weight to height. That's really all it is. And weight can be muscle weight, it could be body fat. So someone who's, 100% muscle, no body fat, could have a high BMI, but they're in perfect health. So it's not the best measure, but that's what the guidelines state. With that said, I have had patients who don't meet that BMI criteria because I feel like they are at risk for all of these comorbidities because they have family history, or maybe they've gained a lot of weight in a short period of time. So there are other ways that you can qualify for it. Insurance coverage is a different, you know, situation, but I would say that a lot of people qualify for it, even if they don't meet those guidelines.
Gotcha. Thank you. And Katrina, tell us a little bit about why you went on it and what you've experienced.
Oh, what I've experienced. This is a loaded one, and it's a good one. I made the executive decision to explore GLP when one evening I was upstairs with my aunt, and I took my blood pressure just for funs and giggles, and I was 141 over 109. And I was like, ooh, we're not doing this anymore. That scared me. It was a good little wake up call. I knew probably about a week prior, we as women, I'm sure everybody in the room, even if I can't see your faces, you may be able to relate here a little bit. I almost felt like I moved into like a new category. I could feel it on my body. I was like, ooh, I've gotten another 2 or 3 pounds on, right? And I could just feel that in my body. That evening we had actually went out to dinner, and you know those Mexican Cokes, the ones that come in the bottle that are the raw sugar, I was able to take down 3 of them. And I was like, oh, that's really different. I really don't like that, right? Like I've never been able to do that in my life, and I don't know why that's happening. We're not comfortable with that. So there were some things that really just kind of woke me up a little bit. I made the decision to kind of look into, okay, like if I were to do something like this, what would the journey be? Just like Rachel was kind of talking about, like I didn't want to just rely on a medication. I knew that it was going to be a full lifestyle change, and I didn't really understand that until I talked to Bracha and her team, which was very eye-opening. And I have had the most fun committing to all of it. I started GLP-1. My first dose was on December 29th of 2024. I am 6 weeks and 3 days in, and I started at 168. I am today 144. That is
Wow.
2 days. Massive, right? That is 2 days of strength training a week, 10,000 steps a day, at least, a half hour cardio, and then a full complete overload on my diet regimen. So I've really tried to just stick to, obviously intaking the right amount of protein, 90 ounces of water a day, like doing the things and staying fully committed. And I've had wonderful results thus far. So
Yeah, amazing. Thank you.
You're
So,
like inspiring me now.
so when you pick
come
up
work out with
Instagram
me,
right
Rachel.
now,
Come to me.
when you
Sorry.
pick up Instagram right now, you can't go a minute without seeing GLP-1s cause thyroid cancer, GLP-1s cause any kind of cancer, gallstone, you name it. Bracha or Dr. Halstrom, what do you guys think about that? What do you think about all these new articles coming out every day saying, this and that about what they always call it Ozempic, but we know it's not always Ozempic. What do you think about that?
I'll
So
let you go.
Okay. So it's so funny because I think that's like the number one question from my patients is like, am I going to develop thyroid cancer? Or like, I have a thyroid nodule. Does that mean I can't take it? Or I have a history of thyroid cancer. Can I not take it? And the answer is always no. So no, that's not a contraindication. Yes, you can definitely take it. So there's been nothing to show a cause and effect from GLP-1s and thyroid cancer per se. However, we did see in animal studies what some of the first trials that came out that led to Ozempic's FDA approval showed some sort of cause and effect between GLP-1s and medullary thyroid cancer. It's a very rare version of thyroid cancer. I would say less than 0.01% of the population who has thyroid cancer actually has medullary thyroid cancer. So that's the only group of people who should avoid GLP-1s. There's no association with the more common thyroid cancer, which is papillary thyroid cancer. It has no adverse effects on thyroid nodules. And there was an early study that showed that there was actually no increased risk of pancreatic cancer, breast cancer, or other thyroid cancers with these medications. So that can definitely, that myth can be put to rest because there's really no association.
Terrific. Thank you. And Bracha, what kind of patients do you see that come in for GLP-1s? You know, I've heard people say, oh, you have to be very heavy, or, oh, you have to have a certain body type. Is that what you're experiencing as well?
Sure. I just want to add one thing to what
Yeah.
Dr. Halstrom was saying, is that another side effect that people ask about is nausea. And if you learn to use the medication correctly, you will not experience nausea. The nausea happens when your sugar starts spiking on these medications, and it's almost your body talking to you. It's like a coach talking to you and telling you, I don't really like what you just ate. It doesn't mean if you're not feeling nauseous, it doesn't work. But when you do get nauseous, it's almost a way of that is talking to you. And so if you learn how to eat foods that are good when you're on a GLP-1, or you learn how to move away from high carb, simple sugars, you likely will not feel nauseous on this medication. It's really just about training your body how to eat. And I see it as a beautiful thing. Something's giving you guidance about real-time feedback about what your body's feeling. The type of patients that I would say come to us at IVDRIPS are really patients they gained weight after giving birth and they were not able to return back to their body that they were before they, had children. Someone that gained weight during COVID, a lot of patients who just do nothing different, but they just gain weight like during menopause, which is like a really
Menopause.
yeah, like 8 pounds for no reason, doing nothing different. And so people who just really struggle to lose weight, most people have been struggling for many years. They are doing everything and they're just frustrated. They're like, I don't feel good about my body. Sometimes it's medical conditions, but sometimes there's not like the blood pressure is high, but I just don't feel good about my body. A lot of females say, I don't feel comfortable looking at myself in the mirror. I don't feel comfortable looking at my body. I don't like how I look in pictures. I avoid pictures. I mean, some people don't even, they'll send me a before picture. They're like, I don't really have a lot of before pictures because I actually don't like how I look. And it's how they feel. And I think I hear it so often. Patients are just like, I'm so frustrated. I can't lose weight. I wish I could do it naturally, but I'm still here years later and I can't. And I think slowly people are learning that really weight loss is not about willpower and it's so much more deeply complex, and something like this could help them get to the goals that they want. So
Great. Thank you. Okay. Katrina and Rachel, just a quick round. Did you have side effects?
Katrina, you go
Katrina?
first.
I had side effects week two for one day. And it was because I switched my injection site. So I listened, right, to everybody saying, hey, don't always go to the same injection site. So my first injection site was in my stomach. I did the other side of my stomach. I learned real quick, okay, we don't like that side of the stomach. It's been the arm since, both arms, and I've been fine.
Interesting.
I also am 100%, I will say to Bracha, like I hear what she's saying about the high carbs and the sugar. I really did everything I could to refine my diet before I made a decision to start GLP-1s. And when I went on them, sometimes you have the sweet tooth. Sometimes you have okay, like I want the extra potatoes or I want the rice, right? And my body immediately tells me, okay, wait, not too much, right? And so just listening to that, right, is a big thing. I've only had 2 bouts of nausea in total in my entire 6 weeks and 3 days on. One was from, again, injection, and the other one was from a food intake. So.
And you, Rachel?
So interestingly, I had no side effects, no nausea, not feeling tired, no fatigue. My like craving for sugar didn't go away at first. So you need to like listen to your body. And again, I want to just like clarify this. I know I took a look at like who's on the webinar. You have a lot of women. There are also so many men that I speak to that want to really start the journey. And I have to say that not having the side effects is such an important thing to talk about also, because I want people to know it's not the same for everybody. It's like no two pregnancies are the same, no two journeys are the same. And you have to also, like, when people are telling you, oh my God, are you sure you want to start the journey? Like, you're going to be super sick. I had no side effects. Like what Katrina was saying, she had one day. I had the first day I did the injection. I remember it was on a Friday. I was maybe nauseous for like an hour and then it went away. So for all those people asking, am I a candidate? What's my weight that I have to be? Am I going to be nauseous? What's the side effects? You need to really speak to somebody that really, really is knowledgeable, like a doctor or like Bracha, and only speak to them. I always say there's a few things you do not discuss with people: your children, your business, and your spouses. You go direct to the source. So if you're going to ask 100 people their experiences, you're going to get 100 different answers, and it just like might steer you away. And for somebody, like what Bracha was saying was so point, like right on, the willpower. Losing weight sometimes has nothing to do with willpower. So you could really, like, I know this is not like part of the question, but it made me think about it. You could not start the journey because of influence through people. So do not get influence from the negative. Speak to somebody like Bracha, speak to a doctor, and see if you're a candidate from the inside out.
Terrific. Thank you. Okay, so I know a lot of people are talking about this. Dr. Halstrom, I'm curious. I've heard people say, oh, you can't start it because once you start it, you're going to be on it for the rest of your life. If you start it, you can never go off because you're going to gain 100 pounds if you go off of it. You can't start it because it's addictive. Can you demystify this for us?
I love
Yes.
this question.
So first of all, definitely not addictive. There's no, center in the brain which is telling you to keep taking it. It's actually sort of toning down some of the reward centers in the brain, which are telling you not to eat. You're not hungry. So the cravings go down from it. So it's like almost the opposite of something that's addictive. Um, as far as coming off of it, I have had patients come off of it successfully. And these are patients who made a decision to change their lifestyle. When they started it, they didn't just start the medication. It was like they changed everything. They changed their dietary habits. They increased their exercise. They got on a good exercise regimen. They met with a nutritionist. They tracked their food intake. They tracked their protein intake. It was really so much more than starting the medication. And it was just a lifestyle change that they continued when they came off of it. Everyone will gain a couple pounds here or there back just because you're eating a little bit differently when you're off the medication, but that doesn't mean you're going to gain 100 pounds back, and everyone's experience is different. Some people gain 2 pounds back, some people gain 10 pounds back. It really just depends on how committed you are to the lifestyle change. It is generally indicated as a lifelong medication, but that does not mean at all that you have to be on it for the rest of your life.
I've heard people say, Bracha, that one of the ways not to stay on it a lifetime is to microdose it, and people are microdosing it. What does that mean exactly?
Sure. Great question. So I would say, we saw certain studies when people go on these medications, when they change their lifestyle modification or when they don't, you usually will see that both populations, both groups will lose the same amount of weight, but the people that keep the weight off are exactly what Dr. Halstrom said, where they changed their lifestyle. Those are the people who kept the weight off, and because they're also using the tool to learn new habits. When you're microdosing on these medications, so sometimes microdosing not everyone needs high doses. There's the Ozempic doses that work for people who are trying to control your sugar, but not everyone needs to go that high. It's not necessary for everyone. It's not one size fits all. Microdosing could happen either they just go on lower doses or they don't use it as often. Sometimes we microdose people for other reasons outside of weight loss. For example, we put people on it who just struggle with binge eating, not necessarily looking to lose weight, but just in general, the obsessiveness. Or even I put patients on it who have bulimia, who couldn't control the impulses. So the microdosing could happen on different levels. I mean, a lot of times I put people on it who are in their 70s, they're want to lose weight, but they actually don't have a strong appetite. Someone like that, I'll microdose because I don't really want to cut her appetite, but I want to also decrease her sugar spikes. So we play around with it. It's art and science together. And then sometimes patients go on it to lose weight. So we go on a little bit, not very small doses, a little bit higher, enough to decrease their appetite. And then once they lose the weight, we microdose them to maintain it. But also sometimes they don't need it for the weight loss anymore. At that point, they saw the benefits of the drug, of the inflammatory response that it has. It decreases inflammation in your body. So certain patients just stay on it because they see, hey, my skin's better. I'm having less inflammation in my body. I feel better on it. And they keep on taking it at a lower level, not to decrease their appetite, but to get the benefits of longevity.
Thank you. So, Katrina, you talked a little bit about lifestyle change. And Bracha, you keep mentioning lifestyle change a lot as well. It sounds like it's not a magic pill, and you do have to have a lifestyle change in addition to taking this medication. What does that mean for you, Katrina, and how can you share that with this group?
Yeah, for me, it is an overhaul, like complete overhaul in my entire life. It started with my diet, absolutely. I think my biggest first concern moving into the GLP was the side effects and then whether or not I could get off of it, right? So Dr. Halstrom's answer in a space of like, hey, listen, like you could, if it's sustainable, was the first answer that I got. And my question became, how do I make this sustainable, right? If I'm going to leverage this as a crutch, I'm going to learn the new habits and I'm going to create a better lifestyle for myself. I've never done that in my 30s. I am 33 years old and I still feel like I'm 19. It's great, right? But I'm not behaving like I'm 19 anymore. I'm not as active as I was. So I told myself, okay, we're going to clean up the diet, beautiful. And we're also going to get back into the gym and we're going to find the things that make me happy in a space of keeping my body active, right? Like Dr. Halstrom again said, keeping track of everything. And that's just because I'm on, again, a hyper awareness space and a hyper education space right now. It's not even more so I could lose the weight without the tracking and I could, I'm working with a personal trainer. I'm 2 days a week, I'm strength training with him and then the cardio. And he's telling me, hey, look, like, let's do the caloric intake and make sure you're watching your calories. But it's interesting for me. It's more so like, hey, like I want to know how much protein I'm intaking. I want to know how many carbs I'm intaking so that eventually I can get to a point where I know what meals I can eat and what makes me happy and keeps me, obviously sustained. And so I think it's a big education piece, the big commitment comment and the lifestyle comment keeps coming up in a space of, for me, I really dove into it from an educational realm.
Amazing. Everyone on this call so far is talking about protein. Bracha, why is protein? I mean, my friends that are on it are drinking liquid protein. They're counting their protein. What is it? Why do you have to be so conscious of protein?
Okay, so protein is essential for our diet. A few different things. One is you should be working out on this medication, lifting weight, resistant training. In order for that to happen, you need protein. Whether you're on the medication or not, you need to have protein when you're having that sort of lifestyle. The other thing that's important to know is when you go on these medications, your appetite does decrease. So you have room for like X amount of food. Usually you have room for this. Now you have room for this. You have to make decisions about what you're going to eat. You only have there's only X amount of hours in the day that you have to make decisions about how you're going to spend those hours. Same thing happens when your appetite decreases. You need to make those choices. And the choices that you need to make have to be high in protein, high in fiber, because those are the things that are going to decrease your sugar spikes when you pair it up with carbs, and they're going to help you keep full for longer. So when you have less room to eat less food, you have to make decisions to eat foods that are going to fulfill you. When you do those things, that's how you're able to sustain the weight loss. When you just say, you know what, I'm not hungry, I could actually just pick from these few fries and just pick from this, and I get to eat all these things and still be skinny. If that happens and you fill up the amount you have in your stomach for just those small amount of foods, and when you go off the medication, that's not going to work anymore. You really have to stick to the fiber and protein to have a healthy, nutritious body, because if you only have X amount of space. You have to eat things that are going to help you grow muscle, hair, skin, nails, and give you nutrients, and also for long-term results.
Amazing. Rachel, how has this weight loss journey supported you and helped you?
So, great question. And I wanted to answer that before. So, everybody has this, like, I would see either wake up call or like epiphany. I'm not happy. You know, I always say it comes like from an emotional part, right? We look in the mirror, and even though it's a physical aspect, going back to what I said before, it's like it's the inside out and the outside in. I really didn't like how I looked. I was menopause and I didn't know. So the first time Bracha reached out to me and said, Rachel, what do you think about starting the journey? And I was like, she asked me first, are you done having kids? And I said, no, I still want to have another baby. And then slowly I realized I was menopause. And Katrina, you're a little too young for this. I went into early menopause. I'm a gene carrier, and one of the symptoms is early menopause. I'm only 44, and I'm already menopause for 2 years. And I would say in the past 2, 3 years is when I really started to put on that thicker, heavy weight. Like it wasn't like 1 or 2 pounds, it was like 3, 4 pounds. And I work in a clothing store, right? So it's like, let's say a banker, right? They wear these beautiful suits and they have to have this like certain powerful feeling. A suit empowers you. When you work in a clothing store, to feel lumpy and schlubby, that's like always the word I use. It doesn't feel great to sell someone else a dress. And I would see the difference in my performance in the store. And that's when I started listening to the inner Rachel. I need to get back to me. And this is what I always say. You need to have a conversation with yourself. Don't ask your friend if starting, you know, the journey is right for me. You have to consult with a professional. I called Bracha and I said, I think I'm really ready. I'm menopause and the weight is just coming on and not going off. And that's how I really started. And it made me feel great because I made the decision, I made the commitment. But, I'm so happy that we're actually doing this panel because now I'm listening to somebody. Oh, my light just died. Sorry. Listening to like Katrina and how she's so motivated and she's really listening to herself and the intake and becoming like really worldly and knowledgeable makes me stop and say, you know what? This is important. Like, I have to start taking the other kind of steps because no, it's not a magic pill. And maybe I have to start doing those things. I'm like a foodie. I munch at night. I have to, like we all have those things. So, anyone that's considering, starting the journey, they have to really be committed. You don't have to, I don't want to overwhelm anybody, but like there are certain steps that you have to take. And it's 1 week, 2 week, 3 weeks. I'm not saying anything to, scare anybody away. It's on the opposite. Come in with the right frame of mind. I want to make the commitment. I want to feel good. I want better for myself. So when people ask me and they're like, am I going to put on the weight if I stop? You know what? Bracha has walked me through that because all those questions that everybody has right now, we've all had those questions. I'm sure Katrina has those questions. It's a day by day, week by week. Be positive. Bracha walked me through it. She said, if you ever want to go off of it for whatever reason it is, we'll slow down your dosages. There's an answer to every question. So that's how I started, and I'm really thrilled. We can't hear you.
Uh,
You're muted.
Oh, thank you. Thank you. Dr. Halstrom, a quick question for you. As I hear everybody talk about this, I can't help but think about what is the future of GLP-1s? How do you see this being incorporated into our world? Is there any research going on right now? Is it helpful in other areas? People are using it for weight loss, but are there other things that we're learning about this drug?
Yeah, I feel like every day there are more and more indications, more research coming out. The most recent thing that has come out is that there is now an indication for GLP-1s in patients with obstructive sleep apnea. So, without any other weight issues or other comorbidities, it's now being covered by insurance for sleep apnea. And that
Can I
definitely.
interrupt you? Why is that? That's so interesting.
That's a good question. I would imagine it's because of the weight loss that you get with the GLP-1 that's decreasing the
Wow.
like the soft tissue in the palate and in like the in the neck, which is improving obstructive sleep apnea. But as far as like the science beyond that, I'm not even sure if we know. But we are seeing improvements in sleep apnea, decreasing CPAP settings, coming off of CPAP. CPAP is the machine that helps with sleep apnea. It prevents apneic events, basically stopping breathing through the night. There are also studies that have shown that it improves cardiovascular health. So again, people without obesity, without type 2 diabetes, these medications are being approved in the context of someone with cardiovascular disease, history of heart attacks, stents, stent placement. And there are studies now going on showing, or, it's showing some promise in the context of chronic kidney disease and improving kidney function. So there's definitely a lot of research coming out. There's also an oral GLP-1 that's currently being studied that's separate from the one of our older oral GLP-1s known as Rybelsus. So a
Wow.
lot of research coming out.
Amazing. Seems like it is a little bit of a miracle drug. Um, Bracha, so one of the things that we talked a little bit about was side effects, but also, is there anything else we should know about as we consider a GLP-1? Of course, there's the side effects, but is there anything else we should be thinking about as we think about considering it? Do we have to think about family history? Do we have to think about heart disease or high blood pressure? What do you look for to determine if someone is a good candidate?
So, of course, if someone has any sort of cardiac history, family history, they're not necessarily there, but they're the prediction of the way they're living their life. A lot of times we'll put people on a glucose monitor and we'll see maybe their hemoglobin A1C, which shows if they're diabetic or not, isn't diabetes yet, but we could actually see on a glucose monitor with some simple blood tests if someone's going to become diabetic in the next couple of years, which is very cool. So at that point, hey, why should we wait so many years? By the time you have diabetes or have high blood sugar, so many different things had to break down in your body for your body to give up in that area. And so the fact that you allow your body to get there, that's a problem. So let's fix it while we're still okay, when your body's just sending little signals saying, hey, it's too much sugar. I'm starting to store it in my fat. That's what happens, right? We store it in our fat, our adipose tissue, or our liver. So those are things that we look out for. But people could use these drugs not only for weight loss. I consider it a brain drug as much as I consider it a gut drug, meaning it helps people lose weight and it slows down your GI tract and makes you feel full for longer. But it does a lot of things in our brain that help us. So people who are suffering with like alcohol addiction or just impulsive behaviors. That's what we said about binge eating. This drug, what it does is it delays instant gratification. And I believe that we're going to see more and more studies come out. Aside from the cardiovascular stuff, we're going to see more and more studies coming out about using these drugs for addiction for multiple different things, whether it's smoking, alcohol, binge eating. We see it for sugar addiction, but what other addictions are we going to start seeing it? And because it delays that instant gratification that happens in our brain, it splits what I think logically, what I feel emotionally, it splits those decisions. So it allows people to make different decisions when dosed correctly, which is basically a brain drug. And that's really cool because then you could use that to develop new skills to make new habits. So that's like how we use it at IVDRIPS as a more of a brain drug. And I'm fascinated by it. It's really cool.
That's amazing. How important, I think, Katrina and Rachel, you've both talked about lifestyle change, how you definitely have to commit to a lifestyle change. Katrina, how important is like a support system or I don't know whether it's nutritional support or, physical support or what you should eat every day. How important is that when you're taking this medication?
I wouldn't say that it's like a game changer, but it is something that keeps me going on a weekly basis. So it's a game changer for me specifically. I see a dietitian once a week, covered by my insurance, which is great. So she was the one who really helped me obviously understand like, hey, listen, how do I tweak this for this? How do I tweak this for this? Right. Again, it was just so important for me to try to understand how to do those things instead of just relying on the internet or my NP, Alyssa, who works for IVDRIPS, has been nothing but helpful in spaces of support of anytime, again, just like Rachel said, Bracha picks up the phone and calls her, right? Like that's important for me, checking in, constantly checking in. My friends, my family, right? The physical support, I made the executive decision to go see a personal trainer because I wanted to learn and understand how to do the things properly from a strength training realm because of the fact that I knew how important that was. And I also, again, from a lifestyle sustainability standpoint, I want to be able to sustain that when I'm done, right? So anything I can build to mold for myself now, even if I'm, obviously still not seeing a personal trainer by the time that I'm not done dosing, great. I've learned the things that I need to from that space. And that has been absolutely obviously he's in my ear and he's looking at my watch information and texting me. And it's been vital for me to have the support systems
Amazing.
across the board.
Amazing. Rachel, how about
So,
you?
so because I'm a very authentic person, my journey right now is very different than Katrina's. But what I love that she's saying and what I really value about Bracha is your body is maintenance. Your body, the intake is so important. It's like you get this beautiful orchid plant, and if you don't water it and you don't give it sunlight, it's going to die. And you're like, 1 minute, I bought this plant. It's supposed to be an orchid. It's expensive. Like, why doesn't it not look as beautiful as it was when I bought it? It's because you're not giving it the support that it needs. So it's the same thing with GLP-1. If you do not take the proper steps, the water, the protein, drinking the water, and these are the things that Bracha told me from the beginning. So in the beginning, I lost the weight, and Bracha keeps telling me, Rachel, if you don't start eating right, exercising, lifting weights, and cutting out the sugar, you're not going to see the same rapid results. And it's such an important thing. And that's why I keep stressing it, because you can't look at somebody and say, oh my God, she lost so much weight. You are not her and she's not you. The same thing with Katrina and I. Katrina's losing the weight so fast because she's taking the proper steps and she's really committed. I'm committed to injecting, but I need to be committed to everything else. So if you decide to sign up and say, I'm going to do this, you need to be the voice inside, because the only one who's going to help you lose the weight is you. So you need to be committed to say, I'm going to get the trainer, I'm going to go to a nutritionist, I'm going to drink the water. If you commit properly, I guarantee you, this is not a sales pitch because I'm really honest. Even like I was looking at the questions before and I called up Bracha, I said, I'm honest. Bracha, I'm not going to say I exercise because I don't. Because I know there are people listening out there that are like, wait, I have such a hard time exercising. I want them to know that's me. And then there are people like motivated like Katrina that are motivated. So I'm listening to Katrina and I'm like, wait, you know what? I want to be one of that living proof that I could lose the weight faster now if I start exercising. Maybe tomorrow morning I'm going to wake up. And then you know what? In 6 weeks from now, I'm going to lose 6 more pounds, because you know why? In the past 6, 8 weeks, I called Bracha and I said, I haven't lost any weight. She's like, Rachel, this is why it's so important to have somebody like Bracha administering the medicine because you have a friend, you have a professional, and you have somebody cares about you and wants you to see the results.
Terrific.
But I
Thank
will
you.
say too, you have to be ready, right? Just like Rachel said, like I was in a
100%.
space where I was not ready for years, and it was like a wake-up call. It was like something happened to me overnight and everything shifted, and I just threw myself head first into this self-determination, and I'm gonna learn the lessons that I need to about delayed gratification. And thank God
Yeah.
it's a brain drain too,
And I want to
because
just,
you
I like
know,
that. And I want to say one other thing, you know, because I work in a dress shop and I hear a lot of girls talking because women walk in now that were like a size 14, 16, and now they're like a size 6, 8. And I hear women saying, oh my gosh, I have a wedding. Give me the number to IVDRIPS. You look amazing. And I tell them, this is not like a quick fix. You need to be ready to do it long term. That doesn't mean that you need to stay on it forever, but you need to know it's not just the potion. If you want to do it, you have to do it. It's not just, you remember the watermelon diet? These like
yeah.
crash diets,
Yeah.
right? GLP-1 is not a crash diet. It's a commitment. It's a lifestyle change. You have to say, I am ready, not for your friend, not for your husband, for you.
Mm.
Terrific. Thank you. So I think we have time for one more question. Then we'll open it up. If anybody has any questions, please put it in the chat. But Bracha, one of the things that has come up quite a bit with people is the cost of this. Does insurance pay for it? Do they not pay for it? How do you get them to pay for it? What's the world around this?
So unfortunately, the world would be amazing if insurance did pay for all of these medications, because we'd have, you know, in a couple of years, a perfect world and everyone would be in perfect health. But it doesn't. We take care of patients who we don't work with insurance. We take care of patients who are not usually diabetic, but they want to lose weight, 20 pounds. They don't feel like their best self, or even if they couldn't get covered by insurance for whatever reason, believe it or not, a lot of people don't get covered by insurance, even though they really should, or they really do need it medically. And so the amount of days that you would wait to see if insurance covers every single day, you are allowing yourself to have more sugar spikes, more inflammation, putting yourself every day at risk for more cardiovascular risk. So it's not worth the wait. And also, if you don't feel good about your body, it's like, how much do you want to invest in your health? How much do you want to invest in your confidence? You think about when you go out to eat, like the amount of money you spend on food for dinner. I always say, one, you'll be spending less money on dinner because you're going to be eating a significant less. I think you'll actually save money on this medication, to be honest, because there's no Uber Eats in the middle of the night because I'm craving something. At that point, you're able to control those impulses. So you actually save money. But how much money do you want to, you have to look at it as investing in your health. Like, how much money is my health and me feeling good about my body and myself when I show up to the world? How do I want to show up? I want to show up feeling good about myself, because that will come back to you and reflect back. So it's important, and especially for the woman out there, like wanting to feel good about your body and feel good about yourself and look in the mirror and say, I love my body and I love myself. And, and I speak more because I think it's, a lot of women say, I don't want to be vain. I don't want to be so vain, like to lose 10 pounds. It's not vain. Like, you look at the mirror, you should love how you look. You should love your body. You should feel comfortable looking at yourself naked. Like, that needs to happen. And way too many women don't. And I think it's like an investment you make in yourself for, one, confidence reasons, but two, also like health benefits. And I think it's a worthwhile investment, very much worthwhile.
Thank you.
I want to just interrupt for a minute. I love what Bracha said, and I want to like really amplify this. Vanity is a very, very important thing, because if the concept of vanity didn't exist, women wouldn't feel that urge inside to look good. And it's a push and it's an incentive. There's a balance for everything. So a little bit of vanity in everyone's life is a good thing.
Terrific. Thanks. Dr. Halstrom, a couple of people have asked, can you be on this if you're trying to get pregnant?
That's a good question. You cannot. So we don't have really any data to support the safety of this in pregnancy. My recommendation is that you would stop it 8 to 12 weeks before becoming pregnant. I have had patients who are on it, and for a multitude of reasons, their fertility improves, they become pregnant, and we stop it right away. So, and that leads to a healthy pregnancy. So I'm not going to say that it could harm the baby, but we generally say if you're planning pregnancy to not start it or come off of it.
Terrific. And somebody also asked, I saw, if I had skin cancer and pancreatitis many years ago, can I still qualify for this?
Great question. So, as far as skin cancer goes, no risk. You can take the medication. Pancreatitis is a little different. So, we normally will say that if you have a history of pancreatitis, you do not go back on, you do not take this medication. There is a very, very small risk of pancreatitis with GLP-1s. So, that I would say is like a relative contraindication.
Yeah.
Okay.
Agree.
We're getting close to time.
That's different than, that's
Yeah,
different than.
I just, no, I want to just say
Okay.
one thing. Even if people are having it already administered, they started with somebody else and they don't see results, it's okay to like call up Bracha and say, listen, I started, I'm not happy. People call me all the time. They're like, I'm already doing it through my doctor, or I'm getting it here. The whole point of it is to be on the right track. It's the same thing like exercise. The person who is administering it is just as important as the exercise, as the intake of the right diet. It's a full circle.
Terrific. One other question, Dr. Halstrom. Is it recommended to take any supplements with GLP-1s?
Yes.
I think that's like user dependent. Everyone might have a different answer. I'm not a huge supplement person. I believe that everyone should take a multivitamin to get adequate vitamin D, calcium. A lot of people on it are women. A lot of those women are postmenopausal. So for bone health, it's good to be on vitamin D and calcium. As you lose weight, your bone density decreases. So that's really what I tell people. The protein is huge. It can be taken like in supplement form, like in powder form, but you can get it through the diet. But other than that, I'm not really a huge proponent of supplements.
Okay. And somebody asked if they have a history of gallstones. Can they be on Ozempic?
Another great question. So, this is sort of a gray area for me. I actually have one patient who I know has gallstones, who I did put on the medication, but I sort of went back and forth for a while because there is a risk of increasing the amount of gallstones, increasing the volume of gallstones with the medication. But I felt like with her, the benefits of the medication outweighed the risk. She knew the risk. I explained that to her, and we decided together that it was a good idea to start the medication. With that said, there is a possibility she'll need to have her gallbladder removed, but it's not an absolute contraindication.
Gotcha.
Yeah.
And then someone else asked if the nausea is very bad, do you ever prescribe something for it, or how do you deal with it? How do you have your patients deal with the nausea?
So I'll prescribe Zofran, which is an antiemetic. It's an anti-nausea medication. It's very safe when used appropriately. I'll prescribe that as needed for patients, and that usually, for the most part, fixes the nausea.
Yeah.
Yeah. And also I say adjust your diet. Adjust your diet. If you're feeling nauseous on it all the time, look into what your dose is. Is it too high? Are you able to eat enough food? And then also what are you eating? Like take a diary and
Sugar.
understand.
Bracha, is there a, like, should you expect a certain amount of weight loss over a certain amount of time? Like, is there any standard?
Okay, so according to like the FDA, between Ozempic and tirzepatide, I think it's about 10 to 15% of body fat, but everyone's different in terms of how quickly they'll lose weight. Obviously, if you have more to lose, you'll lose weight faster. But everyone's different. I mean, some people do really well on semaglutide, some people don't. Some people do really well on tirzepatide, some people don't. And it really just depends. So many different factors. But at average, I would say 10 to 15% of body fat.
Gotcha. And I know somebody else asked if you can go on it for just a few months.
Yeah,
is
that's a
that
good question. You could, I mean, you could go on it for 1 month. It's completely safe. But if you're looking to lose weight and have sustainable weight loss, I mean, you're not really going to get anywhere for like a month or 6 weeks. It's not, it doesn't work like that. Again, like if you want an injection to just control your appetite and completely turn off your control center to ever feel hungry, of course you'll lose weight in a month or 2 months. Of course you'll lose weight. That's obvious if you're not going to eat anything. But when you go off of it, you're just going to gain it back. So you have to use this drug as a lifestyle. So when you use it as a quick fix, you'll get a quick fix. You'll get exactly that. So I mean, it's you're just not using the drug correctly. And when you hear all these stories, it's because people are not using the drug correctly. It's a beautiful drug. You just have to use it correctly. I mean, I feel like if you don't want to use it correctly, just don't go on it.
Gotcha. Okay, we are at time. You guys were great. Thank you so much for taking everyone's question.
Thank you so much for having us.
Yeah, great job. And thanks to everybody for showing up today.
Thank you.
Have a wonderful night, and
Bye.
everyone should see success on it.
Appreciate you. Thank you.
Bye.
Good night.
Bye.